Melissa is someone who's the ideal candidate in that she really is within her ideal body weight, and she just has that little stubborn fat that's about an inch to pinch that with this treatment she could probably see up to about 20 to 25% reduction in fat from a single treatment.
Wow, stunning. So Dr. Fabi, the question that everyone is wondering, have you yourself had treatment? And can you share that story?
Yes, so I've actually had treatment. I usually always do treatments on anything that I recommend to my patients. I think it's something that provides more authenticity, and I like to believe in whatever it is that I'm recommending to my patients. And so I've personally had it done in my lower and upper abdomen, as well as in my inner thigh. Once I had great results in my in my lower and upper abdomen, as well as my flanks, I decided to move forward and do my inner thighs. And I actually did a video and shared it with all my patients because they want to know, okay, can you really work while you're, letting that fat freeze? I always say it's little to no downtime, but really I got up from the table and I actually went right to do my news segment straight away after I did my session. So yes, it really didn't hinder my life at all.
So you were comfortable enough to continue your day just as you usually would.
Right, and confident enough to recommend it to all my patients.
I love it. So you mentioned a few different areas. You said you did your lower abdomen, your upper abdomen, as well as your flanks, and that got you so excited that you ended up going back to your inner thighs. Can you tell the viewers all of the areas that we're able to treat with CoolSculpting?
Yeah, and so some other areas that are also indicated include the submental region, or that, chin area, as well as the submandibular region right underneath that jawline. It's also indicated in a great treatment for the upper arms, and then just that little bra fat roll right in front of the arm that sometimes women really get bothered by and self-conscious about, specifically with some dresses that they may wear. And then that posterior back, or kind of bra, that bra fat that kind of starts to hang over your sports bras or your bras, as well as the upper and lower abdomen.
Now that we have a list of all the areas that are FDA cleared, I want to throw it back to you, the viewers. In the comments section below, please share the area that you're most interested in treating with CoolSculpting. Extra kudos if you do add the snowflake emoji. Wow, we're getting a huge influx of smiley faces, of snowflakes, of areas that you're excited to have treatment. Thank you so much for your participation. We're really excited to be here with you. And now, Dr. Fabi, I think it's time for us to really meet our first patient and go through the first portion of the consultation, which is our assessment.
Perfect. So I have the pleasure to have one of my most beautiful patients, Melissa, with me.
Hi, Melissa.
And so Melissa's 39 years old, and like we had chatted a little bit before, she had already done CoolSculpting previously, and you had pretty great results.
Amazing, yes.
Yeah. And what areas did you treat then?
Upper and lower abdomen and my flanks.
Wonderful. And so because she had such a positive response, she decided to consider coming back. And now tell me, you gained a little bit of weight because you had...
Well, I had my second child, and after my second child, I did lose the weight, but the stubborn belly fat just would not go away. So I have this annoying, just poochy stuff that I'm just trying to get rid of. I eat really well, I exercise, and it's so stubborn. So.
Right. And so, you can tell with Melissa, right? So, she's tiny, and just like everyone, she just has, and she's a great candidate, it's just that inch of fat that she has, that if we could just reduce that up to about 20 to 25%, I think she would see a nice contour and slimming down of that area, and may make her feel a little bit more comfortable in her clothing. And so when you had that procedure the first time, any problems afterward? How did you feel? Did you go right back to your life?
Yeah, I went right back to work. I did it on a lunch break, and I went back to work, and I felt fine, no issues. The only issue was get the fat away. It takes a little bit, but it was, yeah, I was just really excited for my result.
And I know you've waited, because we discussed something that I always tell patients that do gain that little bit of stubborn fat after pregnancy is to give it at least 9 months. And you had said it perfectly earlier.
It took 9 months to get it on. It takes 9 months to get it off. It did for me, at least.
Yeah, so after about that time is when I invite people back, because if you don't need anything to reduce that fat, if you're able to just do it with a little bit of weight loss and exercise, and that's perfect. But it's really when there's a stubborn area of fat to treat. And so I'm going to kind of go through my markings, and I think this is a very important part of the procedure for any of you considering this, whoever's performing this procedure for you. Because I do a lot of lipo, my care and concern is first, where's the fat? Based on where the fat is, then I decide how many different little cups I'm going to apply. So I don't let the cups bias me. And so with her, I always encourage everyone to let it all out. I know we like to suck it in, and that's fine. And so then I mark where that fat really is, because we don't want any area not properly treated, because it does work. That's the reason why it is so successful. And so if you only treat 2 pockets of fat, then you may notice the other pockets of fat. And so I think it's important to treat truly to transformation. Treat everything that you do see is contributing to that more fatty appearance. And so with her, once I've done that, then I take my little handy card and it guides me. And so this is basically the surface area that that cup is going to cover and treat. And so I recognize that if I can fit one of those there, another one there, another one there, another one there. And so with her, I kind of see where is that peak of fat, and in her I see it right there, right there.
So Dr. Fabi, I
Yes.
think this is a great process. I heard you speak to the fact that we're really treating from bottom all the way to top to make sure that we've got the full area covered. When you have a patient in front of you, how do you decide what area to start with and perhaps how many rounds of treatment they might need?
That's a great question, Brooke. So I first ask them what area bothers them the most.
Okay.
Many of us are like everything.
All of the above?
All of the above. But it's kind of like decorating a house, right? And so there's always that one room that needs a little more help than the other, that needs to be caught up to match the rest of the house. And so that's kind of how I approach CoolSculpting. So with Mel, we had discussed earlier that it's really, her lower and upper abdomen area. And so I might go here first, keeping in mind, okay, I'm gonna treat this. If I flatten this out, will it change the shape of her body? Will I square her out more? Do I need to get into her flanks? When I treated her flanks, it really did work. There's not a lot of stuff to treat here. So if I brought this down, it's gonna match her waist, and I think that that's gonna look aesthetically pleasing. Mm-hmm. So I try to look at the person, in a more holistic way, just to make sure that I'm still, contributing to a nice feminine shape. Yeah. And so then after that, I tell them at about 4 months, because in studies we have seen that it can really take up to 4 months to see that full correction, that we can reassess, and she may need another treatment session covering all of these different areas to give her the result that she's looking for.
Wonderful. So it sounds like during consultation, you really have an elaborate conversation with your patients, understanding their goals, as well as how the technology works so that you can determine a customized treatment plan that will help them achieve those goals that they're looking to reach.
Absolutely. It's like with anything related to the aesthetic space, it just comes down to imparting realistic expectations and educating and empowering your patients to make the best decision for them.
Excellent.
Yes.
And Melissa, we know that why you had your first round of treatment. What is it that's inspiring the second? Do you have an upcoming event? Like, are you attending a wedding this summer? Do you have an anniversary to celebrate?
So I'm going to be turning the big 4-0 in a few months.
Woo!
And like Dr. Fabi and I talked about, after having my second child, this stubborn belly fat just won't go. I'm going to turn 40, I'm going to feel amazing, and I'm hopefully going to look even better.
Yes, and I think that that's the key thing, is that it can take up to 4 weeks to start seeing a result, but in most of the trials it has taken up to 3 to 4 months to see the full result. And so timing your treatment with that in mind, if you're trying to look good for an anniversary, for a red carpet moment, for perhaps a reunion, just to kind of plan that ahead. And if you do need 2 treatment sessions, like you're going to see with the patient that we're going to see in a moment, she's getting married in September. And so coming in earlier in the year, like she's doing today, is ideal, because that allows for 2 different sessions to be completed well in time before her wedding.
So a happy early birthday to yourself present.
And so Melly, I'm going to have you step on back, love.
So now that we've seen the first part of the consultation, the assessment, and Dr. Fabi has beautifully walked us through that step-by-step process, now we have Melissa situated on her treatment bed, and Dr. Fabi will walk us through the actual application of the applicator, all of the preparation involved, and then you'll be able to see exactly what it looks like when the applicator is placed on Melissa.
Yeah, so I just basically wipe Melissa down with this alcohol wipe, just to get any like little lotion or potion that she may have applied earlier in the day and even has forgotten that she applied off. It allows me to then be able to apply this gel pad And this is a safety measure that has been put in place. This technology was developed by some of my colleagues, which are board certified dermatologists and scientists at Harvard. And they put safety measures in place, including this nice gel pad that protects that top layer of the skin, because what's brilliant about this technology is that it selectively targets fat. So fat has a higher temperature in which it freezes than the skin. So you can safely freeze and selectively destroy the fat without compromising the skin at all.
Dr. Fabi brings up a great point, which is not only does CoolSculpting have a gel pad to protect our patient's skin, but inside of the technology built into the system are also safety measures.
Exactly. So even the machine prompts me and reminds me that I should have applied a gel pad, and then it makes me confirm that. So there's many safety measures in place, and it won't even allow me to advance if for any reason there is something not working with the system, which is brilliant.
Now, Dr. Fabi, before you apply, I want to hear from Melissa, what does that gel pad feel like when she applied it?
It doesn't feel like anything. It wasn't shocking. It wasn't very cold. It was room temperature. It didn't hurt. It just felt like something gooey.
Yeah.
Getting slapped on my skin.
Right.
Not
So
bad
a
at
little
all.
ooey, a little gooey, but not uncomfortable.
Oh no, not at all.
Wonderful.
And so now we're going to go ahead and apply it. And Mel, you're going to kind of share with us
Okay.
what you feel during that application. And Marie's going to come in. Marie's my lead medical assistant who helps me typically with all of my CoolSculpting procedures. Because the key with this is that patients have appropriate placement of that cup and that we keep them really, really comfortable. So we have a special chair, as you can see here, where Melissa is seated, just so that we can bring it up and down as necessary. And then we put these little boppy pillows, which are just safety measures to kind of hold the cup where it needs to be. And then we accommodate her and her legs just so that she feels a bit more comfortable. And then the nice thing is that there's even a little button that we're going to leave her with, so that if she decides that she wants a glass of water or something to eat, she can just essentially page us and we can come right to her, because the machine does have a little call pager that is associated with the device.
Excellent. And Melissa, you've had the treatment before, so you knew what to expect.
Yeah.
But for our viewers who may be considering whether or not CoolSculpting is the right treatment for them, could you describe what it felt like to apply the applicator?
It just felt like when Dr. Fabi kind of pinched my skin to assess me, it didn't feel like anything more than that. Not uncomfortable, nothing, no discomfort whatsoever. It just felt like someone kind of pinching your tissue.
Yeah, drawing it into a cup
Yeah,
almost.
yeah.
And so now I'm going to start. So you're going to tell me if you feel anything different.
What do you tell your patients to expect during this point?
Yeah, so for the first 5 minutes, I usually tell them that they may feel like a cool sensation. I know I experienced it when I was treated, which is what's probably helpful, that, I've had it done myself. And then I always remind them during the consultation that, common side effects include, especially right after treatment, a little bit of swelling, which is temporary, bruising, because if you pinch the skin up to 35 minutes, you can potentially get some bruising, especially in some more than others. And that there's this numbness that some may experience, and that typically, again, is temporary.
And those side effects typically taper off by the time the patient leaves the practice so that they can get along with their regular routine.
Right, exactly. And then of course you can always visit for more information the CoolSculpting website to kind of just learn more about the side effects involved.
Exactly, and that is www.coolsculpting.com. So Melissa, I'd like to know, how are you going to spend the next 35 minutes? Do you plan to take a nap, since you are a mom and likely never have time to yourself? Will you read? Will you get a little work done?
It's only 35 minutes. I'll probably just scroll Facebook and Instagram. Maybe take some selfies. I don't know. We'll see.
I love it. Yeah, we actually have a TV that our patients commonly have access to. I know that I worked on my computer and got through emails because I get about 200 of those a day. But whatever works. The nice thing about this is that it is really comfortable, as you can tell, and it doesn't interfere with the rest of your life.
Wonderful. Well, thank you for allowing us to see the first part of treatment, from the assessment all the way to the application and the initiation of cold. We actually have another patient that's midway through treatment in the other room. So we're going to take a look at this treatment and what it looks like at the very end. Should we go?
Wonderful. Thank
Excellent.
you so much.
After
Bye,
you,
guys.
Dr. Fabi.
Thanks, Melly.
Bye.
Thanks.
Thank you.
Welcome back. We are here with our gorgeous second patient, Stephanie, who's midway through treatment. She's had her flanks treated. Oftentimes patients say they've never loved their love handles. Steph, would you tell us what treatments felt like for you, how it's been?
It's been amazing. I actually have not felt anything during this past 30 minutes.
Yeah, what have you been occupying your time doing? Did you take a nap? Did we interrupt that?
No, you did not. I actually decided to read a book since there was so much light in here, so that's what I did.
Excellent. And so you've had CoolSculpting before, yes?
I did about 2 years ago.
Okay, what area?
Lower abdomen.
Wonderful. And you were so excited with your results, you came back for this area now?
That is correct. I was so excited for it.
So Stephanie, tell me, do you have a particular red carpet moment that encouraged you to come back for treatment today?
Oh yes, of course. My big moment is I'm getting married this Halloween, so I gotta look good in my black gown.
Yay, congratulations.
Thank you.
And so something that Stephanie and I talked about is that just to kind of get her the result that she's looking for, I always tell my patients it may need 2 sessions. It's one treatment can offer you up to 20 to 25% improvement, but to get more of the result that you're looking for, you may need a second cycle. And so to give her enough time to see those results starting in the earlier part of the year will offer her the opportunity to get those results by late October.
Yeah, that's such a great point, to be able to have that conversation ahead of time, really understand her goals. She's looking to look amazing in her little black wedding dress.
Yes.
And so making sure that you've got enough time to lead through for a potential second treatment.
Right, because commonly sometimes I see brides come in or mothers of the bride or groom that come in a month before the wedding or the big day or even like a reunion, and that's just not enough time. So I don't think it's ever a bad idea to go in for a consultation to kind of get a plan for what the upcoming year is going to look so that you can look your best for that day.
Wonderful. So we've got just a couple minutes on the machine. Dr. Fabi, can you talk us through what our patients should expect? Anything that you talk your patients through for after the treatment is done?
Yeah, and so the nice thing is that, Steph has already had this, so she has, realistic expectations of what can be done. But this is a very common scenario for me in my practice, in that at least 50% of the patients that do CoolSculpting are ones that have already had it and are extremely satisfied with the treatment. The other 50% are typically new CoolSculpting patients that have heard so much about it and how successful it is. And so what I always tell them is that this is not, a weight loss substitute. And so, Steph, she's a very fit individual who, just like everyone else, has that stubborn bit of fat that she can't get rid of. And if she did lose all the weight to get rid of it, her face would be affected, right? And so then they're coming in to see me for other things, and patients are aware of that you lose weight everywhere else to really get to that body that you want. Other things are, have to suffer for it, specifically the face. And so to not lose the effect of what we've done in her face, CoolSculpting is a nice alternative. And so she just has that inch of, fat to pinch. I'll tell her that what she's going to expect after this is that the area is going to probably feel a little, there's a little discomfort sometimes as I take off the applicator, but she'll tell us herself as that blood rushes back into the area that's been pinched for the last 35 minutes. And then it might be a little pink afterward. Swelling is very minor. So I always tell my patients it's no more than what you may feel like if you're bloated. You notice it, but nobody else does. And then she will possibly feel a little bit of numbness in the area, and that can last about 4 to 6 weeks, but it's never an issue. It's more when you touch on the area, not something that you actually feel when you're just walking and doing your daily activity. And then in about 4 weeks, she starts to notice a little bit of reduction, but it really takes about that 3 to 4 months for her to see the full result from this treatment cycle. And then that's the reason why we elected to start earlier in the year, so that she has those 3 to 4 months. She can come back, and if she elects, we can do another cycle for her wedding in October.
Wonderful. Stephanie, you've had the treatment before, just as we mentioned. Now, this time, what were expectations like? Did it feel relatively the same? Was it a casual treatment for you?
It felt the same as it did once. I never felt it anything. Just a mild pinch when you put in the cup initially, but after it just goes completely numb.
Excellent. Well, I think we've got perfect timing. I heard the treatment end, so let's walk us through the next steps.
Yeah, and so basically, Steph is just going to stay nice and comfy as she is. And sometimes with my tiny patients, the nice thing is that we have all of these other little, tools to help that cup sit nice and in place. And so it's nice and easy. Just move it off. And Stephanie, how are you feeling? Is it feeling weird or anything like that?
No, everything feels good. I don't
and
feel
then,
anything.
if you guys are able to kind of see, it's just a little pink, afterward, but nothing that anyone would notice. By the time she gets home, it's going to essentially be gone, right? And then at this point, I usually massage, because there's great study out there that actually shows that if you do massage the area for a solid 2 minutes, you get a significantly greater reduction on the side that's been massaged versus the side that hasn't. And so in our practice, we're in the customary practice to massage the area.
Wonderful. Stephanie, walk us through how you're feeling right now.
Especially as I massage.
I honestly don't feel anything. I feel a pressure that her hands are there, but other than that, I don't feel anything at all.
Just a little sensation
A
coming
little
back?
sensation coming back. Not too bad though.
Excellent. Well worth the 2 minutes.
Totally worth it.
Excellent. So we're wrapping up here in just a moment. You've been able to see a treatment from beginning to end. And Dr. Fabi, after you're done with the massage, would you mind taking a few questions from our viewers?
Absolutely, it's my pleasure.
Excellent. Well, we really want to thank everyone for submitting questions by email before we did this program. We have some exciting questions coming through right now. So to begin with, while you finish up, Dr. Fabi, Mike would like to know, does the fat come back?
Right, and so if you do happen to gain weight, the fat cells that have already been destroyed have been destroyed. The other fat cells that are still present in the area can always still get bigger. So that's why it's important that you pick stable patients in their body weight, so that if they don't gain weight, they're going to hold that result, because those fat cells are gone.
Excellent. So once they're gone for good.
Yes.
Excellent. And Chelsea would like to know, what areas can we treat with CoolSculpting? I know we addressed this earlier on in our session. However, we've had some new people tuning in. So can you cover those one more time?
Yeah, so what I always tell patients is that it's that submental area of that neck, so that double chin. And then more recently, there's been indication for what we call the submandibular area, or that fullness right underneath the jawline. So treating that can give you a more enhanced jawline. And then also the area right here, the anterior axillary fold, which we call it. And then of course, we have the upper arm. And then we also have that bra fat roll. So that posterior axillary fold, that is that fat pad that kind of rolls over the back of the bra. We also have upper, lower abdomen, flanks, and then it's also indicated for the inner thigh, outer thigh, banana roll, and essentially the lower thigh.
Ashley's interested to know when you see final results from CoolSculpting.
So I usually tell my patients that you can start to see results as early as 1 month, but it really takes between 3 to 4 months to see the final results.
Our next question is from Elizabeth, and she's curious for when she can return to work.
Yeah, and so, I mean, Stephanie, when you had this done before, when did you go back to work?
And that same next hour I did.
Right.
I took like an hour break and I just went to work right afterwards.
Yeah.
And what about yourself, Dr. Fabi?
I did it
You
during
said
my
the
lunch
same?
break, and then I actually went right back to work. Patients aren't in that much discomfort that it gets in the way of their daily life and activity.
Wonderful. And to address how CoolSculpting works, that's Tammy's pressing question.
Right, and so this was a technology that was developed by some of my colleagues at Harvard. They're board certified dermatologists and scientists. And what they found was, what we see in dermatology is that with little kids, when they suck on a popsicle, it actually can freeze the fat, but leave the skin absolutely intact. And so going back onto that, what we've noticed is that fat cells freeze and get destroyed at higher temperatures in the skin. So you can selectively treat them or induce them to die without doing anything to the overlying skin. And so that's essentially how CoolSculpting works. We draw in your fat, and it's essentially being cooled by panels that are within the cup. And so those panels are set at proprietary temperatures that freeze the fat, destroy that fat, and then over a period of about 4 to 6 weeks, your body clears that fat from the area, so that at about 3 to 4 months, you see the reduction from those fat cells no longer being there.
Wonderful. Simple explanation. And then our last question is from Sarah, and that is, how much does it cost? Dr. Fabi, I'll take this one also. And Sarah, if you've been tuning in for the rest of our demonstration, you've been able to see the comprehensive evaluation that Dr. Fabi has performed on both Melissa as well as Stephanie. And that's really what we encourage in order to determine the cost. Because everyone's body presents differently and everyone has different goals, what we really encourage is for you to schedule a consultation with a practice in order to determine what treatment plan will help you reach your personal goals, and then at that time the practice will discuss pricing with you.